Your feet are talking to you right now, not with pain, not with something obvious enough to make you call your doctor, with something quieter, a tingling you've been dismissing as nothing, a cut that took longer than it should have to heal, a patch of skin that feels different under your fingers than it did 2 years ago. And if you're over 50, there is a specific reason your body chose your feet to send this message first. And most people spend years not understanding what it means until they're sitting in a doctor's office hearing words they weren't prepared for. I'm Dr. Elena Marsh. I've spent more than 2 decades in clinical practice watching the same pattern repeat itself with devastating consistency. Patients who had every warning sign written on their feet for years before their diagnosis. Patients who came in for something else entirely. A blister that wouldn't close, a toenail that kept thickening, and left with a conversation about blood sugar that changed their lives. A 2022 analysis published in Diabetes Care found that nearly 50% of people with type 2 diabetes show peripheral warning signs in the lower extremities before they ever receive a formal diagnosis. 50%. That means 1 in 2 people had the answer written on their body and didn't know how to read it. Today, I'm going to teach you how to read it. We're going to go through 9 specific signs, not vague descriptions, not, "you might feel this." 9 precise physical changes that your feet and lower legs display when blood sugar is disrupting the systems that keep your circulation, your nerves, and your skin alive and functioning. I'm going to tell you exactly what is happening inside your body when each one appears, and then I'm going to give you a specific structured protocol you can begin using today that addresses the underlying mechanisms driving every single one of them. But first, quick question before we go any further. Have you noticed any unusual tingling, numbness, or unexplained changes in your feet in the last 6 months? Type yes or no in the comments right now. I read every single one. And your answer will tell me something important about who needs this information most urgently. Now, let's start with what's actually happening inside your body. Because understanding the mechanism is the difference between following advice and knowing why it works. Most people think of diabetes as a sugar problem. That's not wrong, but it's incomplete in a way that gets people hurt. What chronic high blood sugar actually does, over months, over years, is wage a slow, invisible war on 2 systems that your feet depend on entirely: your vascular system and your peripheral nervous system. Here's the first mechanism, and it matters for every single sign we're going to discuss. Your blood vessels are lined with a single layer of specialized cells called endothelial cells. They are extraordinarily sensitive to glucose. When blood sugar runs consistently elevated, even at levels that don't yet qualify as diabetic on a standard test, those cells begin to malfunction. They produce less nitric oxide, which is the compound your vessels use to stay flexible and open. They become inflamed. The vessel walls thicken. The result is a condition called endothelial dysfunction. And it doesn't announce itself. It doesn't cause pain. It simply begins reducing blood flow to the tissues furthest from your heart. And your feet are the furthest point in your entire body from your heart. This is where the story of your feet and blood sugar begins. Not in your pancreas, not in your bloodstream, but in those tiny vessels that are supposed to be feeding oxygen and nutrients to every cell in your toes, your heels, your soles. A landmark study published in The Lancet in 2018 confirmed that microvascular damage to the smallest blood vessels, precedes macrovascular damage by years in the progression of metabolic disease. Translation: your small vessels, the ones in your feet, begin to suffer long before anything shows up on a standard cholesterol panel or cardiovascular screen. Your feet are the earliest warning system your body has, and most people are not listening. So, with that foundation in place, the vascular mechanism, the nerve mechanism, the reason your feet are the first to know, let's go through the 9 signs. Look at your feet as I describe each one. Some of these you may have already noticed and dismissed. That ends today. Sign 1. Tingling or burning that comes and goes. This is the most commonly dismissed symptom on this list. People attribute it to sitting too long, to shoes that don't fit right, to age. Here is what's actually happening. Your peripheral nerves, the ones that run from your spinal cord all the way down to your toes, are coated in a protective layer called myelin. High blood sugar degrades myelin. It does this through a process called oxidative stress, where excess glucose triggers the production of free radicals that attack nerve tissue directly. The result is a nerve that misfires. It sends signals when it shouldn't. You feel tingling, burning, or a pins and needles sensation with no obvious cause. A study published in Neurology found that this symptom, peripheral paresthesia, is present in up to 54% of patients with undiagnosed prediabetes. Not diabetes, prediabetes. Your blood sugar doesn't have to be in the diabetic range for your nerves to already be under attack. Sign 2. Numbness in the toes or the ball of the foot. Where tingling is the nerve misfiring, numbness is the nerve going quiet. This is a later stage of the same process. And it is more dangerous, not less, because numbness removes your body's built-in injury alarm system. You stop feeling small cuts. You stop feeling pressure from ill-fitting shoes. You stop feeling the heat of a surface you've stepped on. Injuries happen and go unnoticed. This is the mechanism behind one of the most serious complications of uncontrolled diabetes. Not the numbness itself, but what the numbness allows to happen without your knowledge. Sign 3. Slow healing cuts, blisters, or sores. Your immune cells travel through your blood. So do the growth factors your body uses to rebuild damaged tissue. When blood flow to your feet is compromised by endothelial dysfunction, healing slows, sometimes dramatically. A cut that would close in 3 days on a healthy circulatory system may take 2 weeks. A blister may stay raw and open. If you've noticed this in the last year, do not dismiss it as normal aging. Slow wound healing in the feet is one of the most clinically significant early markers of vascular compromise associated with metabolic disease. Sign 4. Skin that is dry, cracked, or flaking on the heels and soles. The sweat glands in your feet are controlled by the autonomic nervous system, the part of your nervous system that runs your body's automatic functions. When high blood sugar damages autonomic nerve fibers, those glands stop working properly. The skin stops receiving the moisture it needs, it dries, it cracks, the heels split. This is not a hydration problem, this is a nerve problem. And it is one of the earliest autonomic signs of peripheral neuropathy that most people never connect to their blood sugar. Sign 5. Feet that are cold, even in a warm room. Cold feet are often written off as poor circulation in a generic sense. But cold feet that are persistent, that don't warm up the way they used to, that feel significantly cooler than your hands, are a direct indicator of reduced arterial blood flow to the lower extremities. Your arteries are supposed to dilate in response to your body's needs. When endothelial dysfunction has set in, that response is blunted. Less blood reaches the foot is cold. This is your cardiovascular system displaying on the surface of your body what is happening in your vessels. Sign 6. Changes in the color of your feet or lower legs. Healthy skin gets its color from blood moving through capillaries just below the surface. When that flow is disrupted, the color changes. You may notice a dusky red or purplish tone when your feet hang down. You may notice that your feet look pale or almost white when elevated. You may see a reddish-brown discoloration around the lower shin, a sign of small amounts of blood leaking from fragile capillaries into surrounding tissue. Any unexplained color change in your lower legs that wasn't there a year ago deserves a conversation with your doctor. Sign 7. Thickening toenails or recurrent fungal infections. Fungal infections thrive when circulation is reduced, and the immune response in the tissue is weakened. If you've had recurring nail fungus, the kind that keeps coming back no matter what you use on it, the question is not what topical treatment you haven't tried yet. The question is why your body's local immune defense keeps failing to contain it. Reduced blood flow means reduced immune surveillance. This is a vascular question disguised as a dermatological nuisance. Sign 8. Hair loss on the lower legs. Most people notice this and think nothing of it. Look at your lower legs right now. Is the hair on your shins thinner than it was 5 or 10 years ago? Hair follicles require a continuous supply of oxygenated blood to function. When the small arteries feeding the lower leg are compromised, follicles gradually stop producing hair. This is a quiet, visible, and almost universally ignored sign of peripheral arterial disease, one of the most serious vascular complications associated with long-term elevated blood sugar. Sign 9. Swelling in the feet and ankles that appears toward the end of the day. The lymphatic and venous systems that return fluid from your feet to your heart work against gravity. They depend on the pumping action of muscles in your calves and on healthy vessel walls. When vascular integrity is compromised, fluid leaks from capillaries into surrounding tissue and doesn't return efficiently. The result is swelling, often worst by evening, often accompanied by a feeling of heaviness or tightness in the feet and ankles. In the context of the other signs on this list, this is not a benign inconvenience. You've been living in this body for more than 5 decades. Some of these signs have probably been there for a while. No one ever explained what they meant, until now. That's not aging. That's your body asking for help in the only language it has left. The research on all 9 of these signs points to the same 2 underlying mechanisms: impaired blood flow and progressive nerve damage, both driven by the same root cause, which means the response to all 9 of them has a common foundation. And that foundation is exactly what the protocol I'm about to give you addresses, step by step, starting today. Has your doctor ever explained this connection to you, between these specific foot changes and your blood sugar? Write never or yes in the comments right now. Your answer matters more than you think. Stay with me, because what I'm about to give you addresses all of this. It starts with something most people do completely wrong before their first meal of the day. The protocol is next. Here is exactly what I want you to do, starting today. This is called the Circulation Defense Protocol. 5 steps, no equipment, no cost. Each one targets a specific mechanism we've discussed, and each one has research behind it that I'm going to give you. Not because I want to impress you with citations, but because you deserve to know why your body responds the way it does when you do these things. Understanding the why is what makes the difference between trying something once and building a habit that protects you for years. Step 1. The 10-minute post-meal walk. Do this after every main meal, every single one. Within 30 to 45 minutes of eating, your blood sugar rises. This is normal. It happens in everyone. But in people with insulin resistance or early metabolic dysfunction, that rise is steeper and it stays elevated longer. Those extended peaks are exactly when endothelial damage accelerates. Here is what changes when you walk for just 10 minutes after a meal. Your skeletal muscles activate and begin absorbing glucose directly from your bloodstream, independently of insulin. This is not a metaphor. Your leg muscles have glucose transporters called GLUT4 receptors that move to the surface of muscle cells during physical activity, pulling sugar out of circulation without requiring an insulin signal. A study published in Diabetologia found that 3 10-minute walks taken after meals reduced 24-hour blood sugar levels more effectively than a single 30-minute walk taken at another time of day. The timing is the mechanism. 10 minutes, after breakfast, after lunch, after dinner. You do not need to go fast, you need to go. Step 2, the ankle pump sequence. Do this every morning before you get out of bed. 2 minutes, non-negotiable. Your circulation is at its most sluggish in the morning. You've been horizontal for 7 or 8 hours. The blood pooled in your lower extremities has been moving slowly. The valves in your leg veins, the small one-way doors that push blood back up toward your heart, have been relatively inactive. The ankle pump sequence activates your calf muscle pump before gravity has the chance to work against you. Here is exactly how to do it. While still lying down, flex your feet. Pull your toes toward your shins as hard as you comfortably can. Hold for 3 seconds, then point them away from you. Hold for 3 seconds. That is 1 repetition. Do 20. Then make 10 slow circles with each ankle. 5 clockwise, 5 counterclockwise. Then, before you stand, sit at the edge of the bed for 30 seconds. Do not stand directly from lying down. This sequence takes 2 minutes, and it addresses 2 of the mechanisms behind the signs we discussed: venous return from the feet and the prevention of orthostatic hypotension. The sudden blood pressure drop that happens when you rise too quickly, and that, in people with autonomic nerve involvement, can be significantly more pronounced. This is the step your doctor has almost certainly never walked you through in a 7-minute appointment. It costs nothing. It begins tomorrow morning. Step 3. Targeted hydration with sodium awareness. 16 ounces of water. Before coffee, before food, immediately upon waking. Your blood is approximately 55% plasma, the fluid component that carries red blood cells, white blood cells, nutrients, and waste products through your vessels. When you wake up, you are mildly dehydrated. You've lost fluid through respiration and perspiration throughout the night. Mildly dehydrated blood is more viscous, thicker, and it moves more slowly through already compromised small vessels. For someone whose microvascular circulation is already under stress, starting the day in a state of increased blood viscosity compounds the problem before breakfast has even begun. 16 ounces of plain water within the first 15 minutes of waking reduces blood viscosity measurably, supports kidney filtration, which is already under increased strain when blood sugar regulation is impaired, and primes your digestive system for controlled glucose absorption at your first meal. The sodium awareness component. If you are on a blood pressure medication or have been told to monitor your sodium intake, do not add electrolyte supplements without speaking to your doctor first. Plain water is the default. It is enough. Step 4. The 60-second foot inspection, every night, same time, before you sleep. This step is not about treatment. It is about detection. And in the context of compromised circulation and reduced sensation, detection is protection. Peripheral neuropathy reduces your ability to feel injury in your feet, which means injuries can occur, worsen, and become infected without triggering the pain signal that would normally bring them to your attention. Every evening, sit down with good light. Look at the bottoms of your feet. Use a mirror if you need to. Look between every toe. Look at your heels. You are checking for 4 things: any new cut or break in the skin, any area of redness or warmth that wasn't there yesterday, any blister or callus that has changed in size or color, and any area of skin that looks darker or has changed texture. If you find any of these and they do not resolve within 48 hours, that is a conversation for your doctor. Not a reason to wait and see. 60 seconds, every night. This habit has prevented amputations. That is not an exaggeration. It is a documented clinical outcome in programs that formalize exactly this kind of structured self-monitoring. Step 5. The post-dinner magnesium window. 300 to 400 milligrams of magnesium glycinate, taken with your evening meal or within 1 hour after. Magnesium is involved in more than 300 enzymatic processes in the human body. Among the most relevant to this conversation, it plays a direct role in insulin receptor sensitivity, the ability of your cells to respond to the insulin signal that tells them to absorb glucose from your blood. A meta-analysis published in Diabetes and Metabolism, reviewing 18 randomized controlled trials, found that magnesium supplementation significantly improved fasting glucose and insulin sensitivity markers in individuals with magnesium deficiency. A deficiency that is, notably, far more common in people with elevated blood sugar, because the kidneys excrete more magnesium when glucose levels are chronically high. It is a self-reinforcing deficit. High blood sugar depletes magnesium, and depleted magnesium worsens blood sugar control. Magnesium glycinate is the form with the highest bioavailability and the lowest risk of digestive side effects. It is available over the counter, inexpensive, and well tolerated by most people. Before adding any supplement to your routine, confirm with your physician that it does not interact with your current medications, particularly if you take medications for kidney disease, heart rhythm, or blood pressure. That conversation takes 3 minutes. Have it. 5 steps: the 10-minute post-meal walk, the ankle pump sequence every morning, targeted morning hydration, the 60-second nightly foot inspection, and the post-dinner magnesium window. Together, these 5 steps address blood viscosity, microvascular circulation, nerve protection, glucose absorption efficiency, and early injury detection. The 5 pillars underneath every single warning sign we discussed today. This is the Circulation Defense Protocol. Write that name down. Say it to someone tonight. It belongs to you now. You came into this video not knowing that the changes in your feet had names, that they had mechanisms, that they were connected, all 9 of them, to the same underlying process happening in your vessels and your nerves right now. You're leaving with the science, the signs, and a 5-step protocol you can begin tonight. That cost you 20 minutes. Use them. Look at your feet before you go to sleep tonight. Do the ankle pump sequence tomorrow morning before you stand up. Walk for 10 minutes after your next meal, not later, not when it's more convenient. After the meal. These are not suggestions. They are the specific, research-backed actions that address what we discussed today at the biological level. Your body has been trying to tell you something. Now you know how to listen and how to respond. There is someone in your life who has been dismissing changes in their feet for years. Someone who chalks it up to getting older and never thinks twice. A spouse, a sibling, a parent who is convinced their cold feet are just cold feet. This video can reach them before the morning it matters. Share it with them, not for this channel, because the information their doctor never had time to give them is right here, and it is free, and it is waiting for them. If you haven't subscribed yet, please do that now. Every week, I bring you honest, research-based information about what your body needs after 50. The kind of information I wish every patient had walked in with before they were already sitting across from me with results that could have looked different. Subscribe. You've already proven today that you're someone who takes this seriously. Keep that going. One more thing before you go. Everything I've shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. The 9 signs we discussed are clinically significant, which means if you recognize several of them in your own body, that recognition belongs in a conversation with your doctor, not just in this video. Bring this information into that appointment. Show them what you've learned. Ask the questions. Before making any changes to your medications, your diet, or your daily routine, speak with your physician first. They know your history. This video gives you the language to have a better conversation with them. That's exactly where good medicine begins. Not in a waiting room, but in a patient who arrived informed. I'm Dr. Elena Marsh. Take care of your feet. They've been taking care of you.